Welcome to Sonia Podcast. Children, teens, when I read this, kudos to y'all. I read this, I said, I'm going to share this. It says, high school students are having less sexual intercourse. That's what makes studies says. The language of young love and lust and the actual behind it are evolving, and the shift is not being adequately captured in national studies. For years, studies have shown a decline in the rates of American high school students having sex. That trend continued, not surprisingly, in the first year of the pandemic, according to a recent survey by the Center for Disease Control and Prevention. The study found that 30% of teens in 2021 said they haven't had sex, down from 38% in 2019, a huge drop from 3 decades ago, when more than half of teens reporting back then having sex. The Associated Press took the finding to teenage and experts around the country to ask for their interpretation. Parents, some of the answers may surprise you. For starters, what is the definition of sex? That's a good question, said Rose, 17, a junior at a New England high school. She thought about it for 20 seconds, then listed a range of possibilities for heterosexual sex, oral sex, relations between sex, LGBTQ partners on her campus. Short-term hookups, known as situationships, are typically low commitments and high risk for both health and emotional perspectives. There are always sneaky links when you hook up in a secret and don't tell your friends. I have a feeling a lot more people are quote-unquote having sex, just not necessarily between a man and a woman. For teens today, the conversation behind sexuality is moving from a binary situation to a spectrum, and so are the kinds of sex people are having. And while the vocabulary around sex is shifting, the main question on the CDC survey has been worded the same way since the government agency began its biannual studies in 1991. Have you ever had sexual intercourse? Honestly, that question is a little laughable, said Kay, 18, who identifies as queer and attends a public high school near Langston, Michigan. There's probably a lot of teenagers who are like, no, I never had sexual intercourse, but I have other kind of sex. The AP agrees to use teenagers' first or middle names for this article because of a common concern that expressed about backlash at school, at home, and on social media for speaking about their previous sexual lives and LGBTQ relations. Sexual identity is evolving. Sexual experts said the CDC findings could signal a shift in how teen sexuality is evolving, with gender fluidity becoming more common, along with a decrease in stigma about identifying as not heterosexual. The point to another finding in this year's study that found the proportion of high school kids who identify as heterosexual dropped to about 75%, down from about 89% in 2015, when the CDC began asking about sexual orientation. Meanwhile, they shared who identify as lesbians, gay, bisexual rose to 15%, up from 8% in 2015. I just wonder if your youth were in the room when the question was being created, how they would be worded differently, said Gail, executive director of the Michigan Organization on Sexual Health. Sex is just one of the topics covered by the CDC studies called the Youth Risk Behavior Survey. One of the main sources of the national data is about high school students on a range of behavior. It is conducted every 2 years and asks about 100 questions on topics including smoking, drinking, drug use, bullying, carrying guns, and sex. More than 17,000 students at 152 public and private high schools across the country responded to the 2021 survey. It's a fine line we have to try to walk, said Kathleen, director of the CDC Division of School Health, which leads the study. From a meteorological standpoint, changing in question will make it harder to compare trends over time. The goal is to take a national snapshot of teenager behavior with the understanding that questions might not capture all the nuisance. It doesn't allow us to go in as depth in some areas as we would like either, she says. The national survey, for example, does not ask about oral sex, which carry the risk of spreading sexually transmitted infection as for sexual intercourse. We try to use a term that we know young people understand, realizing it may not encompass all the ways young people would define sex. Is less teen sex good news? Beyond systematics, there are a multitude of theories on why the report rates of high school sex has steadily declined and what it might say about American society. I imagine some parents are rejoicing and some are concerned, and I think there is probably good cause for both, says Sharon Hoover, co-director of the National Center for School Mental Health at the University of Maryland. Health officials like to see trends that result in fewer teen pregnancy and sexually transmitted disease. But what we don't know is what this means for the trajectory of young people, Hoover said. This year decreased the sharpest drop over record early had a lot to do with the pandemic, which kept kids isolated, cut off from friends, and immersed in social media. Even when life started returning to normal, many kids felt uncomfortable with face-to-face interactions and found their skills to verbal communication has declined, Hoover said. The survey was conducted in the fall of 2021, just as many K-12 students returned in-person classroom after a year of online school. Several teens interviewed said that when schools reopened, they returned with intense social anxiety compounded by fears of catching COVID that added a new layer to pre-pandemic concerns about sexual relations like getting pregnant or catching STIs. She said, I remember thinking, what if I get sick? What if I get a disease? What if I don't have the people skills for this, said Kay, the 18-year-old from Michigan. All those what ifs definitely affect my personal relationship. Now I interact with strangers or personal partners. Another fear is the prying eye of parents, saying college student Abby Toll, who wonders if helicopter parents have played a role in what she calls the babyfication of our generation, a senior at the University of Oklahoma. Toll knows students in college whose parents monitor their whereabouts using tracking apps. Parents would get push notification when their students left dorms and returned home to dorms, said Toll, 22, majoring in social work and gender studies. Toll also noticed a general sense of disillusionment in her generation. She cites statistics that few teenagers today are getting driver's license. I think, she said, there is a correlation between students being able to drive and students having sex. Another cause for declining sex rates could be early access to online porn. Experts says by the age of 17, 3/4 of teenagers have viewed pornography online with the average age of first exposure at 12, according to a report earlier this year by Common Sense Media, a non-profit child group. Porn is becoming sex ed for young people, said Justina Forte, a New York-based sex education teacher. She says pornographic shapes and skews ideas about sexual acts, power, and intimacy. You can rewind, fast forward, play as much as you want. It doesn't require you to think about how the person is feeling. Is there any involving definition of consent? Several experts said they hope the decline could be partly attributed to a broader understanding of consent and an increase in comprehensive sex education being taught in many schools, which has become a target in ongoing cultural wars. Unlike abstinence-only programs, the lessons include discussion on understanding healthy relationships, gender identity, sexual orientation, and preventing unplanned pregnancies and sexually transmitted infections. Contrary to what critics think, she said young people are more likely to delay the onset of sexual activity if they have access to sex education. Some schools and organizations supplement sex education with peer counseling, where teens are trained to speak to each other about relationships and other topics that young people might feel uncomfortable rising with adults. Anika, 14, is a peer ambassador trained by Planned Parenthood and high school freshman in Southern California. She offers guidance to friends in toxic relationships and worried about the the unique of porn among her peers, especially male friends. It is clear to her that the pandemic stunned sex lives. The CDC 2023 survey, which is currently underway, will show if the decline was temporary. Anika suspects it will show a spike in her school. At least students seems to be making up for lost times. People lost those 2 years, so they are craving it more, she says. She has often been in a school bathroom where couples in stalls next to her are engaged in sexual activities. Again, the definition of sex, any sexual act. Anika said, and sexual intercourse is one type of act. To get truly accurate reading of teen sexuality, the involvement of language needs to be taken into account, said Dr. John Stanley, a Columbian University professor who specialized in teenage sex. So this is good. This is so good that children are not...